talking about abdominal breathing for stress relief and why it's so important, right? So when we talk about an abdominal breath, what we're looking for is 360-degree expansion of the abdomen here. So it's not just sticking that belly out, it's not just breathing through the chest, it's 360-degree expansion around from the front of the abdomen, side of the abdomen, and even into the lower back area back here, right? So the way we kind of cue this is we like to tell our patients or athletes, right, stand up nice and tall like someone's pulling you up from the top here, kind of tuck your chin and cue that neutral cervical spine. We're gonna have you breathe all the way out. So literally push all the air out of your lungs to the point where you're breathing everything out. Right, as you do that, you should feel that rib cage kind of tuck on down. From here, we give overpressure. It's a deep breath in through the nose. And fighting 360 degrees in here, so we're tight here. Tension through here as well. Probably a little bit of tension in the back as you get a little bit more proficient at it, right? So the way we like to coach this, and why is it so important? So this is extremely important because this is the way we should naturally kind of breathe and brace prior to any movement. As far as for stress relief, right? Activating that diaphragm actually stimulates the vagus nerve. The vagus nerve is one of our largest parasympathetic nerves in the body. It's actually a cranial nerve, and it starts up here in the skull, kind of travels all the way down, pierces the diaphragm, and innervates all of the internal organs here within your abdomen, right? So when it's stimulated, it's very parasympathetic in nature, which means it activates the rest and digest nervous system. So it kind of brings you down. So this deep abdominal breathing is a great way to kind of de-stress or come down from a rough day if you've had a rough day at work, coming down from a tough workout. Spending a few minutes working on these abdominal breaths can really help to kind of down-regulate the system and get you back into a more zen-like state and help you fall asleep a little bit easier too. So the way we usually coach it is we usually start the athlete or individual on the ground, right? And we call this 90-90 breathing. So the reason it's called 90-90 breathing is your hips and knees are at 90 degrees, right? So we elevate our feet up onto the wall. And the reason we're here is because in this 90-90 position that puts our pelvis at neutral, we have a good feedback from the ground as well. All right, so our spine is nice and long. We have constant feedback as to our spinal position on the ground. So to see if you're actually properly breathing through your diaphragm and using a proper abdominal breath, an easy cue is when you lie on your ground, if you look down at your stomach and you see or feel your rib cage poking out here, just kind of like this right here, that means our diaphragm is not properly engaged and we're incorrectly kind of hinging or putting undue stress on our lower and middle back here. So just like we did when we were standing up, what we're going to do is try to make ourselves as long as possible, right? We're going to put a little bit of pressure on the wall, not too much, but just enough to kind of stabilize the pelvis here, right? So we're at 90 degrees in our knees, 90 degrees at our hips here. We're going to breathe all the way out. Feel that rib cage come down. Once we're there, right, we do 360-degree expansion, so deep breath in through the nose. Good, feel that tightness here, and then forceful exhale through the mouth. And deep breath in. Good. And the goal with these is to get a 5-second inhale through the mouth and a 5-second exhale through the mouth. So give it a try and let me know what you think.